Wednesday. Regretfully, we have 26 additional deaths to announce. On our report on Monday, one of the things on the report was we had a day where we went through 24 hours. We didn't have a death reported, which is a milestone in itself. As it's gone the last few months here. I don't know if this is the fact that maybe some of the deaths that happened over the weekend and everything, we didn't get them in the Monday report, and they didn't get in the system, to be able to get in that Monday report. Or it could very well be what we all know is happening across our nation. There's a little uptick in this thing. We don't want it to turn into a big uptick. But we all know that there is an uptick in this thing, and we've got to be careful. We just got to be cautious about what we do. This thing's not over. It's not over. We've lost 26 more great West Virginians, and I'm going to read them to you right now. Our 2,697th death is an 85-year-old female from Raleigh County. Our 2,698th death, a 57-year-old male from Wyoming County. Our 2,699th death, a 74-year-old male from Nicholas County. Our 2,700th death in West Virginia. It is just unfathomable to think that 2,700 West Virginians are now dead. In fact, 2,722 from this dreaded, dreaded killer. Our 2,700th death is a 78-year-old male from Barber County. Our 2,701st death, a 47-year-old male from Logan County. Our 2,702nd death is a 97-year-old female from Monroe County. Our 2,703rd death is an 82-year-old male from Wood County. Our 2,704th death is a 97-year-old female from Wood County. Our 2,705th death is a 77-year-old male from Logan County. Our 2,706th death is a 58-year-old female from Cabell County. Our 2,707th death is a 79-year-old male from Wayne County. Our 2,708th death is a 76-year-old male from Berkeley County. Our 2,709th death is an 81-year-old female from Cabell County. Our 2,710th death is an 88-year-old female from Putnam County. Our 2,711th death is a 62-year-old female from Mercer County. Our 2,712th death is a 71-year-old male from Cabell County. Our 2,713th death is an 81-year-old female from Kanawha County. Our 2,714th death is a 54-year-old male from Raleigh County. Our 2,715th death is an 86-year-old male from Wetzel County. Our 2,716th death is an 86-year-old female from Putnam County. Our 2,717th death is an 81-year-old male from Fayette County. Our 2,718th death is an 81-year-old female from Grant County. Our 2,719th death is an 82-year-old male from Monongahela County. Our 2,720th death is an 85-year-old male from Wetzel County. Our 2,721st death is an 85-year-old male from Jefferson County. Our 2,722nd death is an 83-year-old female from Mercer County. Hoo-wee. Just think. The last 8 deaths, the ages were 86, 86, 81, 81, 82, 85, 85, 83. And we had some younger folks here, a 54-year-old, a 57-year-old, a 47-year-old, and a 58-year-old. If you are 65 years of age and older, and you don't get your vaccine, you're making a terrible mistake. a terrible, terrible mistake. No matter what anybody tells you, without any question, you are making a very bad mistake not taking your vaccine if you're 65 and older. I truly believe if you're of any age, 16 on up, you ought to be taking your vaccine. But to those folks that are 65 and older, for them not to take their vaccine is not smart. Please, 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 if you've not gotten your vaccine, call us, do anything in the world. We'll come running to try to get your vaccine as quickly as we possibly can. Please get your vaccine. 65 and older, you see, if you get this, you're in tough shape. That's all there is to it. If you get your vaccine, the likelihood of you getting this is diminished unbelievable. If you were to get it, which is highly unlikely, your being hospitalized has gone down phenomenally, and the possibility of death is almost zero. You have got to get your shot. Please listen to me. You've done really good. We're probably approaching 75%, but 25% of 360,000 is almost, probably really close. In fact, it is exactly 90,000 folks out there. 90,000 of you that are 60 and older. 90,000 of you have not had your shot yet. And really and truly, we have got to get you vaccinated. 364 new positives in the last 24 hours. We tested a lot. Our daily positivity rate, 3.76, that's good. Our cumulative is still falling. We're at 5.24 now. Our active cases, 6,897. They haven't changed much. Our recovered cases still continue to rise. They're 134,755. Now we have approaching 300 that are hospitalized, 271 to be exact, and 84 in the ICU units. We only have one county in the red, that's Berkeley now. Thank goodness Raleigh got out of the red and everything, but Berkeley, we need to get them now out of the red. The total map, the number of counties that are in the green is really substantial, and we're really, really thankful and proud of that. Again, if you have any symptom whatsoever and you're 65 years of age and older, please go get tested, please. And if by chance you were tested positive and everything, we can stop this thing with the antibodies. I got a big announcement right now and everything. I want to make this announcement right now, but today we're holding a formal groundbreaking ceremony for the Nitro St. Albans Bridge project and everything, which will replace the Interstate 64 bridge over the Kanawha River connecting Nitro and St. Albans. This Roads to Prosperity project will also widen Interstate 64 in Putnam County from 4 to 6 lanes. Everywhere you look across this state, in all 55 counties, you see roads being fixed and all kinds of activity. I've said it over and over. When we stepped up, 73% of the West Virginians in this state stepped up and said, "We're with you, Governor. We want to go with the Roads to Prosperity thing. Absolutely, we don't believe we're going to have to pay any additional taxes," and you didn't. I promised you that, and you did not. By doing so, we created lots and lots and lots of jobs. Now, everybody's got to know our roads didn't get in this shape on my watch. They got in this shape because of decades of neglect. And absolutely, without any question, we're on our way to getting our roads in our state everywhere, and we're not going to quit until we qualify everywhere. Every single road in this state, we're after to try to make better, to fix, build new roads, new projects, and on and on. This over $1 billion worth of major infrastructure improvement projects through the Roads to Prosperity program have either now been completed to date or are currently underway. Now just think about it. Through all history in this state, the biggest road bond that we ever did in the state was $500 million. In the Roads to Prosperity program, we have now completed, or we are working on it, over $1 billion right now. And before it's over, we'll approach $3 billion. It is amazing. And that doesn't count. That doesn't count all the stuff that we're doing on all the repairs and fixing the slips and pulling the ditches and paving all over the place. That's not in all that. April is again Work Zone Awareness Month. And I urge all the drivers that are out there. I know you get a little impatient. I know the roads, you know, there's orange cones all over the place and everything else. But please understand, we have construction workers all over the place. And in a lot of places, they're like ants. They're running everywhere. And they try to be just as careful as they can be, but they depend on you. They depend on you, our drivers, to be observant on the great job that they're doing every day. So really watch, really slow down, and really be careful in all those work zones. So look after the people that are looking after us. You know, vaccines again, we're back to that. You know, they're available to everybody 16 and above. We're still prioritizing the elderly in every way. The vaccine distribution update, we're 96% of the administration rate, first and second doses. Goal is always to get 100%. Now get this number. Now that we've gotten additional information, you know, from the pharmacies or the federal program or whatever it may be, get this, we have now put into arms doses of 892,596 West Virginians. Heaven forbid. It is unbelievable the number of shots we've given. We have administered on first doses 532,890, and on second doses a little over 359,000, for a total a little over 892,000. And great work by lots and lots and lots of people. Now I'm going to shoot a shot back across West Virginia's bow and just think just a second about this. In the state of West Virginia, there's 1,700,000 and some thousand people. We now have put shots in arms for the first time, 532,000 people. We're just slightly over the people that are eligible, 16 and above. I would say we are slightly over a third of our people right now. We want to stop this thing, stone cold stop this thing. We have got to set a sight on probably 70% of our folks. Now, Dr. Marsh and everybody, all the medical team all across the board is saying, we've got to watch our younger people from the standpoint, not necessarily death, but from the standpoint of transmission. And as they transmit the disease, they may not get terribly sick themselves, but as they transmit this disease, we still got 90,000 folks out there that don't have the vaccine, that are 65 years of age and older. Some of them are going to get it, and some of them will die. We've got to some way realize that our young people have got to get vaccinated too. If we're a third of the way home and we need to get to 70%, we've got a long way to go, and we've got to bear down. Our younger people got to step up. All of us have got to step up, and we've got to continue to stay at this. From the Saving Our Wisdom number, you know, which I love to talk about more than anything because we've gotten 242,204 individuals 65 and older that have got shots in arms right now. And that's with the Federal Pharmacy Partnership and Walgreens and the Veterans Administration and all that we're doing. We are over 75% of those folks right now. My goal is 85%. My goal really is 100%, but I'll take 85. I'll be really happy with 85, and we can get there. So if you're over 65 and you're still waiting, call that number right there. Call that number, and we'll get somebody running to you. Okay, on the manufacturing outreach, you know, again, our joint interagency task force continues to reach out to manufacturers and businesses and churches and all those to say, we'll set up a clinic, we'll come to you, we'll set up a clinic, we'll vaccinate your workers, we'll vaccinate your congregation, we'll vaccinate if you'll just give us a call. That's your number. Give us a call. General Hoyer is standing ready. And he said on Monday that we'll offer vaccine, clinics to our churches. And if there's a church pastor out there, come on, help us. Help us get there. You're going to save lives. Our COVID-19 vaccine info line is up there. Vaccine reminders. Crying out loud, you're not going to grow antlers by taking this vaccine. Don't listen to all the crazy stuff. Just get your shot. Last thing I'd say, I'm not saying this to dwell on the tough or the bad or whatever, but look, we all know all the horror stories about all the deaths. We all know that this disease basically takes your breath away. And as you lie there, gasping for breath, and your loved ones can't even be with you, I don't know how it gets any worse. Please, if you're 65 plus, please call us. Please, some way, somehow, get your vaccine. All of our free testing's up. It's free. If you have any symptoms, anything, any anxiety, go get tested. You know, the drive-through pharmacy testing, again, I thank Frith and Walgreens over and over. Long-term care facility outbreaks, now we're up to 8. We have 8 outbreaks in our churches in 6 counties. That's Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh counties. We got to bear down. Church community, come on, step up, bear down just a little bit here. And where you could really step up and bear down more than anything is have your pastor call and say, we're going to call our congregation in at a certain time. We're going to be there. We're going to vaccinate all those that want to get vaccinated. And that's what we really need. Just help us a little bit there. From a corrections update, we have 73 inmate cases now and 11 staff, 24 at the Southern Regional Jail, 23 at South Central Regional, and 23 at Salem Correctional. All the guidelines on your mask, and I've said it 1,000 times, you know, I don't like it, but I know it saves all kinds of lives. Just hang with us and let's not be crazy just for a little while. A little while. We're really close. Let us just vaccinate more and more and more, and we'll be there. As a reminder, it is mandatory that you wear this in public buildings at all times. There's another reminder about giving blood. Please do that if you've been blessed, especially with recovery from this dreaded killer. You ought to really consider that. Now, here's an announcement from the DNR. And you know, I'm a hunter and I'm a fisherman. I don't know if anybody you know that's really been in the woods more than I. And I haven't been in the woods much in the last few years because my legs are in tough shape, and on top of all that, I surely still try to go some. On top of all that, we've been really, really busy and doing all the stuff we do each and every day. But, I'll promise you, since I've become governor, the grouse have celebrated. I was able to, the year that I became governor, I was able to get 73 grouse that year. I had an incredible bird dog, and that was, she's my real great buddy. And I've lost her now, and that was really tough. But since then, and I'm ashamed of this, but I've gotten 2 1 year, 1 year, 2 1 year, and 1 next year in the last 4 years. And so really and truly, this governorship has really, the grouse has celebrated, I know that. But I want to announce the tiger trout stocking. This is a really different looking trout. It is a trout that is a cross between a brook trout and a brown trout. They're very aggressive in the stream, from the standpoint that they normally bite very, very, now they won't bite you, but they normally are pretty aggressive, and you can catch them a little bit easier, and we're going to be stocking them in lakes and streams all around our state for the first time in decades. This is just the latest example of the unique world-class fishing opportunities we're providing in West Virginia for anglers from within our great state and all those that come into this great state. I've probably been in more trout streams than you could possibly imagine in the state of West Virginia, and I encourage all West Virginians to go do so, as well as all those that are visiting our state. Right now is absolutely the time to go. We're through the months of April and May. We're going to be stocking 25,000 tiger trout amongst all the other fish that we stock, and some of them are going to be trophy size, 4-pounders. So that is really, really something. And they'll be stocked with the other trout species at a rate of 10% of the scheduled stockings. So we're just going to blend them in with the other trout and everything that we're stocking, and just make sure that you got your your fishing license and get out and enjoy this incredible weather and the absolutely just beautiful, beautiful. I mean, this state, like I said over and over, I've had the good fortune of doing good in business and everything, and surely my family taught me to really work. That's all there is to it. Work. And be very thankful for your blessings. Now, there's surely tough times and everything, but along that way, with that incredible blessing, I could have gone probably anywhere. I could have gone anywhere in the world and fished, or I could have gone anywhere in the world and hunted. I really never wanted to go. I really never, ever went. All I really wanted to do primarily was just fish and hunt in this great state. And the reason I wanted to do that, because there isn't any place any more beautiful. Absolutely, take my words. Get out on a trout stream in West Virginia, or get out after a spring turkey in the great mountains of West Virginia, and you absolutely will experience something like you have never experienced ever. It's really wonderful stuff. It'll really, really help your soul. So that's all I got today. Thank you all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And to reinforce what the governor has said, I think those of us who spend time at the medical side and at the science side see the COVID-19 pandemic really transitioning in many ways. And I think because of these transitions, it opens up new challenges to us in West Virginia, as well as us as citizens of the United States of America and global citizens. So as the governor said, we are seeing a rapid increase in some states, particularly states like Michigan and Minnesota, as well as Florida, with the variant virus, the United Kingdom, the B.1.1.7 virus. And as a really quick reminder, although we've said this several times now, the concern about this particular virus is it is more infectious, about 50% more likely to spread than the virus that started in China and ended up coming to the United States through the West Coast, through Washington State and California. And it's also about 50% more lethal. And that's really important because what it says to us in West Virginia as the most highly vulnerable population, as initially reviewed by the Kaiser Family Foundations, is that we're not out of the woods yet. As the governor pointed out, we've seen a number of deaths over the last, since the last press brief. And as we look at the age of people who are dying, we still see our most vulnerable part of our population, our elders, as the majority of the people dying. We know that as we go forward, we really aggressively need to continue to focus on these populations, because we know to save lives and reduce hospitalizations, that's a really key group. And as the governor said, people that are vaccinated are very well protected against the most severe complications of COVID-19. But it only works if we're able to get people vaccinated. And as we look at the B.1.1.7 or the United Kingdom variant that is starting to come into West Virginia, we've seen a steady increase in the number of cases that have been caused by this United Kingdom variant in West Virginia. And although still certainly not at the level of Michigan or other states where we see more explosive growth here, we do understand that if we don't act quickly and act aggressively, that could also be our future. And that would be very concerning, because it's very likely we would see a fairly significant increase in both the number of people getting infected, but also the number of people dying. We know this variant is starting to infect younger people, and some younger people are getting sick. We've talked about the increase, the really substantial increases in the number of hospitalizations of people 30 to 40 and 40 to 50 in states like Michigan. And there was a report in the Washington Post about a series of outbreaks in Minnesota related to extracurricular activities, sports teams, where 187 people were infected with the United Kingdom variant, and a number of people died. And what they noticed about this variant in those cases is, instead of having super spreaders, which is the thing that we worried about earlier, single people that infected a lot of people, there was very consistent transmission back and forth, spread between a lot of the people that were infected in this outbreak and others, including family members, et cetera. So as we very aggressively try to reduce the spread of COVID-19 in West Virginia, and particularly this variant, it becomes really important for us to test and identify people that are infected and do that really good contact isolation, for all of us to continue to wear masks and stay physically distanced when we're out among other people that are not totally vaccinated, fully vaccinated, and who we don't live with all the time. And most importantly, it is really critical for all of us as West Virginians to choose to get vaccinated, because the way that we protect ourselves from complications, death, spreading to other people, is being vaccinated. And right now, as the governor said, about 33 to 35% of our state is vaccinated with at least first doses. We know from the United Kingdom, 50% is the level in which we start to see a lot more protection for the entire population, which would be 15% more. And as we look at Israel, about 66% of their population has been immunized with at least one vaccine, which they have done very well and opened very broadly, even with the United Kingdom variant. And then we know that, you know, when we seek herd immunity, whether that's even possible at this point, but that's 75 to 85% of people vaccinated. So for West Virginia, we've done really well, but we're being challenged once again. And we as a leadership team, and certainly under the governor's leadership, are calling on all West Virginians to please don't let your guard down right now. This is a critical time for us and our state. These vaccines are amazingly effective. They're amazingly safe. They don't cause sterility. They don't keep people from getting pregnant. They don't cause disease. The side effects are really very mild. The benefits are tremendous. So for all of us on the call, we have gotten vaccinated fully. We have our families get vaccinated fully as soon as they are eligible to do so. So we trust this vaccine with the people we love the most. Please do the same for you and your family, because it's only together that we are going to continue to be a beacon for others. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. Just like to reinforce and highlight a couple of things that the governor and Dr. Marsh just pointed out. We are clear in our efforts in the interagency task force that the governor has given us, and we've got, I tell them, 3 primary missions: vaccinate, vaccinate, vaccinate. And we, as the governor pointed out, we are prepared to work with any business, with any church, with any other organization out there that wants to work to coordinate to host an event. We are having a lot of success with our businesses in manufacturing and retail, working events to vaccinate not just the employees, but also family members. We want to do the same thing with our churches. We have some additional initiatives coming up next week. All of our federally qualified health clinics will now be available to provide vaccines. We know they represent about 400,000 of our most vulnerable West Virginians with healthcare support. We've got some initiatives that will continue to grow with VOAD, volunteer organizations active in disasters, and working with our food banks to work to deliver vaccines during food bank and food pantry events. A lot of additional things that we want to do. And again, the objective, as the governor pointed out, 85% of our population over 65, then 85% of our population over 50. But we know we have to get to the broader West Virginia population to make this effective for us and get back to even more normalcy going forward. In addition to that, we are working aggressively this week with the Center for Disease Control and the COVID staff within the White House to refine data and to get more data from those federal programs, such as the federal pharmacy programs, the VA and others, to get a full and complete picture of where we need to go with our objectives that the governor's laid out for us. So again, it's about vaccinate, 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 while we still stay focused on our mask and the things that we need to do to protect West Virginia. Thank you.
Thank you, sir. Dr. Inamjad, our State Health Officer, and Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members and press members. I'd like to drill down a little bit more on these variants. Do we have a solid or approximate number of how many variants have been detected here in West Virginia? Is there a pattern? Are we seeing anything from contact tracing that this is primarily younger people? And what are your concerns with college students that didn't take the advice and kind of went on a spring break to Florida anyway? We had a lot of travel over Easter as well. When might we be getting a firmer idea of how serious the variant problem is in the state?
Dr. Inamjad, why don't you try this a second, please?
Yes, Governor. So, Mark, we are tracking those numbers, and right now we have 2 main variants here in West Virginia. We have the UK variant, or the B117. We have about 142 cases here right now. We also have the California variant, and I believe our last count is about either around 160 something cases in West Virginia right now. We have the UK variant in about 19 counties. Most of those are in our border counties. The top 3 counties are Berkeley, Mon County, and Ohio County. As far as the age group goes, as you're asking, it is in our younger age group population, anywhere from 19 through 40-year-olds are our main age groups that we're seeing it. So as Dr. Marsh mentioned, it is something that we're concerned about in our younger population. That is also our more, I would say, our social population that we're seeing in, which is also why we're encouraging that younger ages to get vaccinated, as well as also to continue social distancing and wearing the masks. I'm not sure what your second question was to that, but that's the basic idea on that. We are, also continuing to sequence any cases that we see that are suspicious of any clustering or any events like that, but we are monitoring those continuously throughout. But thanks.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask a little bit about, the tax plans. The Senate is going to take up their version here later this afternoon. Speaker Hanshaw yesterday said he was doubtful that it could get done by the end of the session. Could you talk just a little bit about your perspective on the negotiations and everything that's happened since the summit on Monday? Thank you, sir.
Well, Charles, I'm very pleased with what we've gotten done thus far. I think in the Senate, there's still a few little probably rough edges. I've surely put a stake in the sand that said that I cannot be for any level of food tax, because I truly believe that that's going to hurt our people that need us the most, and we don't need to do it, but from a standpoint, we really want to have economic development, do we not? Do we want to perpetuate our tourism, do we not? I mean, tourism is booming in the state, or at least, and I tell Chelsea all the time, we have really got it going, but honestly, the sky's the limit. I mean, tourism could absolutely take us to levels like we can't imagine. And right now, all we are is the parsley around the sides of the plate. We haven't really gotten to the meat and potatoes on the plate, absolutely. But getting to the parsley is an accomplishment like we can't possibly imagine. We had to put real dollars in tourism. We had to put in a commitment in tourism, and they have returned those dollars over and over and over to the state. So, incredible investment, But there's, I commend the Senate in so many ways from the standpoint of, I think where we're going to land is, I hope we're going to bring in the things that protect those in the lower wage levels, because we don't have to hurt those people, and I hope we're going to bring in things that are going to bring us more and more jobs, like the Schedule Cs and all those folks, because we can do that. And I really am hopeful that the Coal Association and the gas people are going to join us in this effort and step up. And so I'm really hopeful for some significant modifications to a plan from the Senate side that they stepped up and said they want to go big too, and I loved that. And I loved the fact that they stepped up and said, and from our business communities, our sub-S's, our Schedule C's, our sole proprietorships, we want to help them too. So I'm really thankful to the Senate, for the great work that, President Blair and Chairman Tarr have done. They've done incredible, and all those that are up there in the Senate that are working hard. I think we'll end up, if we do this in a way where we just don't hurt people that are lower income wage earners, and we don't have to do that. We can absolutely do this and put money in everybody's pocket. We can do the cash rebates to the people that are really struggling the most, $35,000 and down, and it increases as the further you go down. Like the 10,000 people, the people with 10,000, make 10,000 or less, they'd get a $350 rebate check. Probably get it over, each quarter they would get a percentage of that, But But we can do this, Charles, and it truly, truly will be the answer to our growth in West Virginia. It'll be the answer to stimulating our own businesses and helping us on a long-term basis, because the stimulus money from COVID will wear out and it'll go away. And the COVID situation, I hope and pray with all my soul, will go away. But this will continue to perpetuate and stimulate our small businesses in this state off the chart. Now, the unfortunate thing we got to watch, and I've said it over and over, and I know this is a long answer, but it's ever so true, because it's the most important thing that we could possibly be doing in this state. We can do all the other stuff. We can address social issues or whatever it may be. We can do all the other stuff, but we know every day we awaken in West Virginia and more people leave. Our population's going down. It's just absolutely going down. We got to do something. If we want to help our schools and our roads and all of our people, small businesses, everybody on a long-term basis, we got to do something. And we got to do it right now, in my opinion. And we got a real chance. Now, I think it's really unfortunate that the House maybe has their, minds closed and everything, and they're not thinking as progressively or open-mindedly, but I am really hopeful that they'll take a really good look at this and everything once it comes out. And like I said, the only thing I've said, and I've made it just as clear as I can possibly make it, I cannot be, even though as badly as I know that, an income tax plan of getting rid of the income tax in West Virginia is so important. I cannot be for something that's going to hurt the folks that need us the most. And so, I think we've made great progress, and I think our summit was great, and I really appreciated all those from the House and the Senate side that were involved. And I think we did. I think we did some really good work there. I hope everybody can totally understand. I have been so flexible; it's off the chart, and so as far as this tiering, let me tell you on just one thing on the coal side, I have been in the total auction by myself, but I have gone down and down and down and down 4 different times. And with all that, there are folks that are really stepping up. I give them all the credit in the world. Joe Kraft at Alliance stepped up and said, we're in, from the standpoint of and I don't know the Murray people, but Dennis Watson is the head guy, and he said, and they're not called Murray now, it's a new name and everything, but I don't know exactly what that name is, said we're in, and I would just say this, Charles, and here is the most impactful thing of all. Do you realize how much credit those people deserve from their own employees? Think about this. They have thousands and thousands and thousands of employees. And most all those employees are making a really, really great wage. Do you know every single one of those employees, if this thing goes through, should go back and thank those 2 people that I mentioned right there. And the reason they should thank them is this. They're going to get an instant pay raise. They're going to get a significant pay raise. That's all there is to it. And we as a state are going to send them the money back. They're going to get an instant pay raise if this thing goes through. And for those that are standing on the sidelines and don't want to do it, those employees should know too that whomever their employers were, they didn't stand with the employees. And so there's lots and lots and lots going on. We're still working it as hard as we possibly can. From the standpoint of the potential need of a special session, hope and pray we don't have to go there and everything. And, but we've made a lot of progress, and it's a big, 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 big item and everything. But it's taken a lot of work and a lot of effort. I'll promise you everybody here is tired. But I've always said, and my dad has taught me this through and through, don't confuse effort with accomplishment, sports fans. Don't confuse effort with accomplishment. Just because we say we tried real hard, that doesn't mean squat. I am all about one thing, accomplishment. That's just all there is to it. I love it when we try real hard. It's important. But at the end of the day, I'm not looking for a gold star for perfect attendance. I'm looking for achievement. That's all there is to it. Achievement. That's how I was raised. And that's all I'm interested in. Anyway, thank you much, Charles. Sorry it took so long.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. The governor mentioned, as he usually does, the outbreaks. We've got several in churches, I think 8 churches in 6 counties. Since live singing was allowed to come back into West Virginia, I've had questions from a couple of different sectors that they wanted me to address to Dr. Marsh, if you could give them some guidelines. One is from churches themselves about singing in choirs or having praise bands. What kind of guidelines would you give churches that would have either select singers or choirs, and of course the congregation now singing, because we all know how much COVID can spread in the church? Can you give them some guidelines? And also from show choir people from high schools, they've contacted me and asked about show choirs. They said that they're allowed to do it or not. They had some discrepancies between show choirs and bands. Some were allowed to participate, some were not allowed to practice. If a show choir is up and running, how would you counsel them, those faculty members, those students, to be safe while we're all enjoying live music? Thank you.
Dr. Marsh, before you go, let me say one thing. And Kenny, great questions, but just stay with me just one second. We're going to continue to give you recommendations on how we can have live singing, how we can do this and that, how we can, go out of our houses, how we can, do whatever it may be. We're going to continue to always give you updates and guidelines and recommendations and everything else. But when are we going to realize? When are we going to realize without any question the bridge that we worked so hard to get to? The bridge was the vaccine. When are we going to realize without any question our answer to this problem is vaccinate, vaccinate, vaccinate? And all of us have got to get on board. All of us have got to get on board to do just that. Dr. Marsh, you take over from there.
Well, thank you, Governor, and thank you, Kenny. So the governor is really, I think, given the answer that I would give as well, is that we know until people are vaccinated and 2 weeks out from their final dose of the vaccine, which would be 2 weeks post 28 days for the Moderna shot, 2 weeks post 21 days separation for the 2 Pfizer shots, and 2 weeks after the Johnson & Johnson dose, that we would not consider those folks to be immune. We know these vaccines are not only really great against protecting people from getting COVID-19, but also seem to be really great against having people spread COVID-19. So I would say, Kenny, for churches, for show choirs, and we've had some extensive conversations with Randall Reed Smith about some of the high school competitions. We would suggest to try to minimize those events, particularly indoors. Outdoors is safer. As we talked about with the spread of the United Kingdom variant, the B.1.1.7, and Dr. Amjad did a great job outlining the numbers of cases that we've seen, but understand that it's likely that we are still fairly substantially underrepresenting the true number of viruses that infections that are caused by B.1.1.7, because we're not able to sequence every positive test. but we're moving toward the hope that we can do a much more extensive job of that, and we've gotten the capabilities to do that. So I think people should be very careful. We should minimize singing in churches, in choirs, in any indoor venues when other people are there. If we're going to sing, we should be outside with good spacing. And I think that the real key is that if people get vaccinated, then it will be much safer for people who are doing the singing not to spread the virus, including the variant virus and the UK variant. And it'll be much safer for the people who are in the audience. So vaccination is the key element for us to really get to the point where we can safely get back to these types of activities.
All right, thank you, Kenny. Next, we'll go to Mark Cram with WDVM.
Well, good morning to all, and Governor, thank you for your kind comments on Monday. As I mentioned before, my questions are always crafted from inquiries I get from our viewers. Last evening, I received a question from a Berkeley County woman, and perhaps this question has been addressed before. She says her husband is 91 years old and homebound, and she would like to convey special needs or communicate special needs to the health department. What is the best way for individuals who may have special needs situations to reach out and convey that information? Thank you.
Mark, are you asking special needs from the standpoint of wanting to get vaccinated and they're homebound, or?
Yeah, she is interested in getting both the vaccine for both her husband and herself, but she says basically her husband is homebound.
Mark, first of all, I love it that she's called you or just called somebody and somebody's told us. But General, you take over from there and let's get these people vaccinated. But take over, General.
Yes, sir. Mark, two things. One, in general, folks in that circumstance, if they will call the hotline and let them know that they have that specific circumstance, the hotline then forwards that to the Interagency Task Force. They work with the local health departments and other assets to make sure those get done. We are doing those daily. In the meantime, for this particular case, you got my phone number. Send me a text with the information, and I'll get it directly to the task force folks, and we'll get them taken care of.
All right, thank you, Mark. Next to Brendan Tierney with WSAZ.
Hi, Brendan Tierney here with WSAZ News Channel 3. We're talking about it being another month or two until there's enough vaccine supply to get everyone vaccinated across the state, especially those younger people that we're seeing the increased cases with here that Dr. Marsh has been talking about with these new variants. So I was wondering, Governor, if you've considered bringing back any restrictions possibly on school sports or extracurricular activities, which have led to a number of different outbreaks. And if not, what guidelines people should be following to help crack down on that spread of the virus?
Brendan, I don't see any need in doing that at this time. I know that every time we do anything, there's some level of additional risk. I mean, we can bubble wrap all of ourselves and probably we'd be a little bit safer, if not a lot safer. You know, we're not going to bubble wrap ourselves. We're not going to absolutely shut down our economy. I think, as far as, our extracurricular activities, I know from the standpoint of being a coach, when I walk in a gymnasium, it is amazing. It is amazing the fact that all the staff that is, at the host school, how they're making sure people are spaced out and people have masks on, and it's not perfect, but it's really good, and so I know everybody's aware and everybody's trying, but right now I would tell you without any question we've got to go on about our lives and we've got to learn to live with this thing, and we just got to encourage more and more and more people to get out and get the shots and get vaccinated.
All right, thank you, Brendan. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel and fellow journalists. I'm trying to wrap my head around the virus and how it is now through variants attacking a younger age group, and wanted to know And I think Dr. Amjad mentioned that there were some outbreaks in schools that we had reported recently. Are you looking at the schools differently now, or are you looking at the same metrics as you judge whether to take additional measures?
Well, let me say just one thing real quick. And this kind of follow up between Brendan and yourself both, but you know, we want to always watch. We're watching nonstop everything, and especially our medical experts are watching everything all the time. You know, there may very well be a situation, I mean, where our situations come up that we got to change, and we will change, you know, but maybe Dr. Marsh, you can take it from there.
Well, thank you, Governor, and thank you, Paul. The governor is absolutely correct. You know, one of the reasons why we've been so focused at trying to open up shots and shot clinics and opportunities with the West Virginia Department of Education and the county superintendents is because we think that an ounce of prevention is worth a pound of cure. And so doing these immunization clinics and targeting our younger people in that 16 to 18-year-old range with the Pfizer vaccine, which is the only one approved for vaccination, and our West Virginia population over 18 years old with any one of the 3 vaccines is very, very critical for us. And we know that, as we've talked about, that a number of these cases are coming in environments where people aren't able to wear masks so consistently or distance. So therefore, we really do want to target our student athletes in our early phase, and we hope that them and their families who haven't been vaccinated do choose to get vaccinated. These vaccines are really effective and very safe. And then we want to move that, you know, through our higher education organizations, our universities and colleges, which we're doing through the Higher Education Policy Commission, and then to younger West Virginians who are still part of that spread. The key for us, Paul, as we look very closely, is we still are not seeing in-classroom spread when we're doing all the appropriate mitigation measures and people are maintaining that vital distance and the discipline to do that. So if we would start to see that happen, then of course we would work as a team and the governor would make the best decision for the state of West Virginia. But we also know that not having kids in person in school has huge numbers of issues, including people getting left behind, failing key courses, not going to college. And those things have great impact, not just on their, you know, life earning capacity and our educational, you know, abilities in the state, but also on people's lifespan. So we know it's really critical to have people in class and do it safely, which is what we're trying to do by really targeting vaccinations at this part of our population and their families. So thank you.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. My question also follows up on vaccinations and school-age kids. So I was talking to the state deputy superintendent for the Department of Education, and she said, you know, as vaccinations continue in high schools, that a benchmark they have right now is 25%. And you know, she got that number from, I'm presuming from either Dr. Marsh or someone in your realm. Could you just tell me a little bit more about, you know, in this race that we're in to vaccinate people, you know, what are the benchmarks we have for our younger folks and, you know, where those are and why they are. So this 25%, you know, could you explain a little bit more about that and just any other benchmarks we've got for younger folks?
June, let me just take the question and everything, and I you know, appreciate your question. 25% is not good enough, June. That's just all there is to it. You know, the messaging. I mean, kids think they're invincible, and we all know that. And we all probably thought that, you know, but 25% is not good enough. And we need to market this situation to our kids, to our parents and everything, that, you know, that this is incredibly safe to our children. And absolutely there are ramifications and side effects, not from the vaccine so much at all, but from the standpoint of, even if you get this, you don't get terribly sick. You know, there's all kinds of possibilities, from long-term heart issues or whatever it may be, and we absolutely need to get our kids vaccinated. They transmit like crazy and everything. We know that. That's a problem with our elderly and everything. More a problem with our elderly, but we really don't know the long-term effects of having this and you know what it can do to us as far as our heart or whatever it may be. And I'm not trying to play doctor here, but 25% is not good enough, June. We got to continue to market and continue to work on that, and we're going to do just that.
All right, thanks, June. Governor, I'll turn it back to you.
Okay, let me think if I've got anything else that I've written down. I really don't have anything else, you know. All I would say is just this. From 100,000 feet, we have 2,722 deaths now in West Virginia. All indications are there's a little teeny uptick. You know, all across our nation, in areas there's a significant uptick. From the variant, you know, the UK variant, we know from our super experts that it is twice as infectious and twice as deadly. We know we've got a third of our people vaccinated in West Virginia. Now, there's a little bit of an uptick. We know the variant that is causing the problem is twice as infectious and twice as deadly. There's a little bit of an uptick. We know we've got a third of us vaccinated. And we're sitting here right now. Jim Justice is sitting here right now. A great, great big cheerleader. And he's saying, we got to get vaccinated. We got to get vaccinated. We're on the cusp of stopping this thing, shutting it down. We know we got to uptick a little bit, and we absolutely know without any doubt that a third of us are vaccinated. We know if you get this, it's twice as infectious, the variant is twice as infectious and twice as deadly. Come on. Come on, West Virginia. You've been superstars. You've been superstars for a year. I know you're tired. I know that. I am too. But we don't rest until it's over, do we, West Virginia? Come on, just help me. Help me like you helped me with the census. I mean, think about it. We all got counted. It will be long-term additional dollars in services to the state of West Virginia forever. You did it, West Virginia. You've been the one that has kept their deaths down. You've been the one all along, West Virginia, West Virginia, West Virginia. We do a lot of things in threes around here, don't we? We triple the triple. We go age, age, age. Now we're going vaccinate, vaccinate, vaccinate. I've said drainage, drainage, drainage on our roads. Absolutely, West Virginia. Now come on, help me. Help me. Be community leaders. Be street leaders. Absolutely help me get our people vaccinated. We got the shots now. We're pleading with you over and over and over. Give us an arm to put a shot in. I got to have you, West Virginia, again. You've been great. Come on, let's do it. Thank you so much.